Hey there, Greg Chaplin, Doctor of Physical Therapy and Strength and Conditioning Specialist, and in this video, we're going to answer a really interesting question. Does PRI work for narrow ISA individuals? Now, spoiler alert, it might not, so without further ado, let's go ahead and jump right in. So if you don't already know, I'll fill you in. PRI stands for the Postural Restoration Institute, and they talk about postural patterns of asymmetry. And the pattern they talk about the most is the left AIC pattern. This pattern is when someone tends to favor the right side more than the left, and PRI's contention is that the left AIC pattern is universal. Now, based on my observations, this is certainly not the case, but I will say that a large number of people fit into this pattern. So it could be definitely useful in certain circumstances to apply these PRI concepts if you do indeed fit that pattern. Now, quick sidebar, there's a lot of people I meet who think they're in this pattern, but really aren't. People are pretty bad at determining this based on their own research, and often there are subtle differences that can make a big difference on the treatment and intervention side. So we're going to talk about that in this video. So anyways, let's go ahead and jump back in. All right, so PRI talks about two things, position and breathing. One of the big contentions in PRI is that individuals are stuck in a state of inhalation. This means they keep more air in the rib cage, and from a stress perspective, this is like being stuck in fight or flight. Now, to help people change this, they use specific combinations of breathing techniques and postures. These techniques often feature cues to get the ribs to come down. So instead of being in an arched position, the ribs settle down into more of a neutral type position. But where this gets a little tricky is when we look at skeletal structures. We're going to be approaching this in this video from a few directions. The first is going to be looking at how the structure impacts breathing. And the second is going to be how the structure impacts movement and thus exercise selection. And then lastly, we're going to be looking at how these might impact results with the typical PRI techniques and cues. So what is this ISA? All right, so a little background for those of you who aren't familiar. The ISA means infrasternal angle, and it's just this angle formed here by the two halves of the lower rib cage. Bill Hartman is the one who's made this popular. He's a pioneer in the rehab field and extends this concept to describe archetypes. In his model, there are two archetypes that have different skeletal shapes. They also have different movements during breathing at the lower rib cage and different tendencies overall. So one is this wide ISA who has the wide flared rib cage. They are wider side to side and tend to be more arched in appearance. They can open this angle more easily than they can close it during breathing. And then on the flip side, you have the narrow ISA. They've got this more narrow rib cage. They also tend to be more of a cylinder shape and have a rounded spine appearance. They can close this angle more easily than open it during breathing. So these narrow ISA individuals use more compression in the side abdominal oblique muscles, where wide individuals use a little bit less. Compression via these obliques help to push the ribs inwards, and a lack of the compression here allows the ribs to stay outwards. Now, how do you know which one you are? To tell which ISA you are, the best thing you can do is have someone who actually knows how to do the ISA assessment assess you. Now, a second best option is to look at yourself just breathing without a shirt on. You could do this in standing, or to really mimic the actual test would be laying on your back with a camera from above. Now, if you can't see the ribs for some reason, having someone to put their hands below the lower ribs can help you. They should be able to check for movement of the ribs during breathing. If the ribs move out to beyond 90 degrees with ease, you're likely more of a wide. If they move inwards to less than 90 degrees with ease, then you're likely a narrow. Some of the rest of this video might also give you some more clues here, so if you're in doubt, just listen to the rest of this video and hopefully you'll get the gist. Now, issue number one with PRI and narrow ISAs is the wrong breathing strategy. So to recap, narrow ISA individuals compress the rib cage when breathing, especially during exhalation. This is where we're going to run into trouble if we apply the usual PRI cues. A lot of the PRI cues feature compression of the ribs during exhalation, utilizing a lot of abdominal obliques. In fact, PRI uses resistance tools like balloons and straws, and this is just going to increase the amount of superficial muscle compression during exhalation. So if we did this with a wide, it might actually help us close this angle, but with a narrow, we're often just reinforcing a strategy that is already overused. So when we do this, we often compress this rib cage that is just already compressed. And to be honest, this conversation could also apply to some wides as well. Anyone that's already using a lot of compressive strategies probably doesn't benefit from aggressive exhalation. So what I see is a lot of narrow ISA individuals who do or don't fit the left AIC pattern that just screw up this breathing, and often in doing this, they just increase rather than reduce tension. The typical breathing pattern I see looks a lot like this. People go into this exhalation phase really hard, and they just depress the whole rib cage as a unit, which actually increases tension on the front of the body, including the abs. This is going to reduce motion of the rib cage because this sternum bone here stops moving well. When the sternum stops moving well, nothing around it, including the ribs and the spine, are going to move well either. So you don't get the normal excursions anywhere in the rib cage, and the net effect is an increase rather than a decrease in overall tension in the system. So narrow ISA individuals need to focus on two things during PRI breathing. The first is just to go easier, decreasing the effort with soft, easy exhales. Now, the second is to allow this sternum to move upwards on inhalation, and then when you exhale next, just allow the sternum to settle back down only as much as is necessary. Avoid crunching that sternum back down when you do your exhales. Now, the second issue faced here with PRI is the assumption that everyone is stuck in extension. So extension is the arching of the spine like this that pushes everything forward, and it's going to be most prominent around the belly. Now, the opposite is flexion, which is going to round that spine backwards. Based on structure, wide ISA are going to have a bias towards extension and narrows a bias towards flexion. Almost all PRI techniques you see are going to emphasize movement into flexion. In fact, the whole concept is about getting into flexion or out of extension, and while this works well for some individuals, like those who bias extension because of their structure or the activities they do, for other individuals who bias more flexion, again because of structure or activities, this is not going to be super helpful. So for a healthy movement system, we want to access both flexion and extension, as well as side-to-side motion and rotational motion. We don't want to limit any one direction, especially if our goal is mobility. If we're limited anywhere, we can train towards one or more of these limited directions to balance out the system. So in general, we want to maintain what we have access to. Nothing wrong with any directions of movement, postures, or positions, but we want to work towards those which we don't have access to. This is going to be especially true, once again, if mobility or range of motion or reduced body tension is your goal. So what we want to do when approaching training is to assess which we do and don't have access to. If we find that we can't access extension, we likely want to train that. A lot of narrow ISA individuals are going to lack access to extension. So extension, again, is this movement forward in space. It means the front of the body has to expand and the back of the body will have to, at least in a relative sense, compress. So narrow ISA individuals are going to often struggle with the following motions. The first is sternum elevation or up pump handle movement. And the second that goes along with that is upper thoracic extension, movement of the spine at the mid shoulder blade level and back. Lumbar extension is that normal curve in the lower back, which is necessary. And then scapular retraction or a back and down position of the shoulders is also going to be difficult. In terms of movement, deadlifts and hinges tend to be a little bit more difficult, and pronation or flattening of the foot towards the ground is also limited. These individuals will often compensate for this with a flat foot, which is something I cover in this video. Now, for a lot of narrow ISA individuals, biasing flexion is not the best idea, at least as the primary theme in training. You can maintain flexion and then train extension, and that's probably going to be a much better fit. For these individuals, extension is actually pretty great. So there's some nuance here, but generally speaking, narrow ISA individuals do great with extension. First, from a rehab standpoint. So most PRI activities would need modification to work well for a narrow ISA individual. I would allow more of the above motions by making a few small tweaks. These would include reaching up and overhead versus down, which is going to allow that sternum to come up and that upper rib cage to move back a bit. This is also going to allow the shoulder blades to compress on the back of the rib cage, which is going to make it easier to expand the front. Then I would allow for some natural arching in the lumbar spine. So this means taking out cues to tuck the pelvis. And I'd also likely use all fours positions, prone, and more extension-based positions. I would also eventually have these individuals working towards more posterior compressive positions. Now, from a training perspective, I'd once again emphasize more extension. The progression should start where the person's at. So if they're really rounded, then going a little less rounded, then working progressively towards extension. This is something you'd figure out with an assessment. So let's say someone was a bit more flexed, right? Rounded shoulders, rounded back, sits all day. In this case, I just want to give someone a slightly more hinge style variation, especially with the lower body. So for squats, instead of being super upright, I might elect to incline the body forward a bit. I could hold a weight on the back instead of the front of the body, which will assist with this. And I could do the same thing with a split squat. Once again, inclining the body forward to help open up the tight lower glutes and upper hamstrings. And then we'd emphasize deadlifts and even good mornings eventually to reinforce these hinging motions and posterior compression. In the upper body, I'd select activities such as rows that compress the back of the rib cage and also do my pushing and pressing motions with the arms at or above about 90 degrees. Now, since this is most of your traditional gym exercises, there's not going to be a whole lot to worry about here. Since narrow ISA individuals are more likely to rotate their ribcage or pelvis during training, I'd watch for that. This is going to happen in one of two cases. The first is where the individual is fatigued, and the second is when force production demands exceed a certain threshold. So in either case, we're just going to identify where that happens and then make the necessary adjustments around it as we go. Now for cues, traditional chest up and shoulders back might work, but there's some nuance here. Often we want the upper chest and back to come up, but not the lower. This is something I dive into detail in my program, Total Body Restoration. So if you want more context and to dive even deeper into understanding these issues, go ahead and join the waitlist at the link in the description. All right, so some final remarks here. PRI is a great tool to supplement a wellness routine for the right person. But like any other model, if it doesn't meet the needs of the individual, then it's not likely helpful. For many narrow ISA individuals, even those that do fit the left AIC pattern, PRI unfortunately just isn't it. Asymmetrical patterns don't exist in a vacuum, but that's another topic for another video. So until next time, thanks for watching and peace.